Welcome to Coronavirus, What You Need to Know. This is our 11th live town hall program in the series. These programs are produced in association with the Sonoma County Department of Emergency Services, with input from public health agencies around the Bay Area and many nonprofit organizations. Good evening, I'm Darren Lachelle, President and CEO of Northern California Public Media.
And I'm Adia White, Assistant News Director at Northern California Public Media and your co-host for tonight's show. Coming up, we'll talk with Representative Jared Huffman about a new legislative package passed by the House of Representatives and what this can mean for the North Bay. We'll also hear about a new Latinx task force put together by Sonoma County to address disparities in our community. Applications open Monday for undocumented immigrants seeking disaster aid. To apply, call 707-228-1338. Again, that's 228-1338, and we'll be talking more about that later on in the show. The county is currently working with the state to proceed with reopening more businesses. We'll talk with County Health Officer Dr. Sundari Mace about the details and ask her the questions that you sent to our newsroom. But first, Darren Lachelle has more on how to submit questions for tonight and next week's town hall. Darren?
These town hall programs give you the opportunity to ask public health officials, medical professionals, and elected leaders the questions that are on your mind. So submit your questions through the contact form on our website at norcalpublicmedia.org/coronavirus. Also, this live program is being translated in Spanish on La Mejor Radio 104.1 FM. Tune in to La Mejor Radio for instant Spanish translation right now. In our first story tonight, Susan Gorin, chair of the Sonoma County Board of Supervisors, spoke with News Director Steve Mincher on Friday in the midst of ongoing changes to the coronavirus rules.
What is it that happened this week? Well, the counties need to react in real time when the governor makes an announcement about additional businesses that he is permitting to open up, sort of entering into phase 2A. Before counties enter into phase 2B with stronger openings, we have to meet a set of criteria that he and the state has established. We are close to meeting that criteria. We've expanded the amount of testing that we're doing countywide, and we're discovering a population, our Latinx community, that really suffering from COVID disproportionately. And we started collecting the racial and ethnic data just recently, so now it's become very evident. So we're increasing the testing starting next week in the Roseland area and the Sonoma Valley area and the Petaluma area to really get a sense of what is happening to and within that community. But the board had an animated discussion about, okay, we're close to meeting the criteria, but we're not there yet. And so there is a mechanism that counties could ask for a variance to the governor for more widespread reopening. And we are in the process of working with our cities, asking for letters of support to then submit an application for a variance. It's not as if we're going to open up the county to every kind of business activity. We are going to continue to balance the public health needs and certainly track the number of COVID cases that we see in our community, as well as looking at what kind of businesses are lower risk that we could contemplate opening up. I believe some of the questions last week involved dog grooming and car washes, and guess what? We're open. So we may be ahead of the curve on some of those businesses that we want to see open.
All right. Now, what you've just said really brings in a viewer question that we got, and I'd like to put this to you. It's pretty pointed. It says, can you please discuss the fact that despite knowing that Latinos are 4 times more likely to be infected, the supervisors are going ahead and asking over Dr. Mace's objections or over her head to apply for a waiver from the governor. Our people, meaning the Latinx community, our people are hurting. So what would you reply to this viewer?
Well, the answer is twofold. Absolutely, we are concerned and put public health at the top of our priorities. We are not necessarily disagreeing with Dr. Mace. We absolutely are listening to her guidance. and will follow the great advice that she has given us. But many of our Latinx community are really struggling to pay their rent and provide food for their families. And we've heard from many organizations providing rental assistance and food assistance, particularly to the Latinx community, and trying to find a solution to start reopening those businesses and to put those folks back to work. So again, we are not ignoring public safety. We have absolutely respect for Dr. Mays. She brings her expertise and experience to us, and we will follow her direction. And we are working with her on the variance and the application for a variance. Because we apply for the variance doesn't mean that we will receive the variance. It's actually sort of a healthy exercise. Okay, if we were to receive a variance, what would we open first? What would have the least amount of risk for our community? And recognizing some of our Latinx community members are really struggling financially. How can we get them back to work in those low risk jobs that they desperately need?
All right, Susan, finally, do you have any final words for us on our Tuesday program that you'd like to leave us with?
I think it's very important to continue to remain vigilant. Fewer people are wearing facial coverings. That greatly alarms me. Please be safe. Please stay sheltered in place. I know you're desperate to get out, to shop, visit your families, and we are putting our community at risk by continuing the transmission of COVID among family members, among our elders. And if you access our parks and they're open more broadly, please wear your facial coverings and please stay safe. It's important.
All right, Susan Gorin, Chair of the Sonoma County Board of Supervisors. Thanks once again for joining me.
Thanks, Steve. I really appreciate the opportunity to be with you.
Please share your questions with us so that we can get answers for you during these live town hall programs. Visit the easy-to-use contact form on our website at norcalpublicmedia.org/coronavirus. There you can fill in your question, share your name and email, and select the subject of your question, then click Submit. The contact form is displayed on every page of the website dealing with the outbreak in the Bay Area. On the page, you will also find the Frequently Asked Questions section where the answers to many of your questions may already be shared. This program is being translated in Spanish live right now on La Mejor Radio 104.1 FM. We thank La Mejor Radio for their partnership on these town hall programs and for the service they provide to our community. And now here's Addie White with Dr. Sundry Mace.
Well, Dr. Mace joins us every week for our coronavirus town halls to answer your questions and give us the latest update on the coronavirus in Sonoma County. So thank you so much for joining us again.
Yeah, thanks for having me. I'm going to keep the update short so we can answer questions today. So we have, as of this morning, 391 cases here in Sonoma County. 183 of them are active, 204 have recovered, and we had 4 deaths that we've reported so far. We did have somewhere around 16 cases today that the dashboard hasn't been updated with yet, but we'll hear more of that by tomorrow.
So we are beginning to see more cases being reported here in the county. Can you talk a little bit about, whether your department is surprised by that, or is that something that you expected to see as we begin to reopen?
Well, yeah, I think as I've already told you in this show as well, that as we open up and relax some of the regulations for shelter in place, we're going to see more cases because we know that it's shelter in place that kept our case counts down so much. So it's expected. However, we are following up with every case, testing all the contacts, asymptomatic and symptomatic, and trying to stay on top of it all.
And what about community transmission? Are we seeing those numbers change as well?
Yeah, I would say in the last week we've seen more cases of community transmission. That is, cases in individuals who have no known contact to someone with COVID or haven't had any other exposures like travel.
All right, so we can get started with the biggest update of this week, which is that on Monday, Newsom loosened the state's criteria that counties would need to meet before allowing more businesses to reopen. And on the same day, the Board of Supervisors approved the decision to submit documents to the state outlining how we in Sonoma County would begin to open more businesses. Can you talk about what the next steps are for that?
Yeah, so we were already preparing with a reopening phase, sort of reopening plan aligning with the governor. And so over the weekend, the criteria, as you mentioned, had been loosened. So we meet the criteria for the numbers of cases and the percentage of tests that are positive and hospitalizations now. So we are moving forward. We have a draft variance for opening certain sectors that we submitted last night to the state, and we're in conversation with the state right now to figure out what they agree upon. And tomorrow we will be able to submit the final variance attestation, sort of asking for certain sectors to be opened, and then they'll post it on the site when they agree with us.
And I'd like to get into more detail about which businesses in just a minute, but first, how did the criteria change since last week, and what new criteria do we now meet that we hadn't met before?
So last week, the initial criteria were that we should have had no deaths in the past 14 days, and we had 2 that immediately disqualified us for going forward with a request for opening. And the other criteria we didn't meet was less than 50 cases in the last 14 days. Because as you know, we've had over 100 cases in the last 14 days. Now, over the weekend, because it was very clear that many counties that are in the middle, like us, having moderate numbers of cases, not as few as rural counties and not as many as like LA or San Francisco, weren't going to meet the criteria. So the criteria changed. Now, it should have had less than 20 people in the hospital per day over the past 7 days, and we meet that criteria. We've had anywhere from 3 to 9 persons in the hospital every single day. And also, of all of the tests performed, less than 8% should be positive. And we've hovered somewhere around 3 to 4% of our total tests being positive. So now we meet the criteria for the case numbers, counts, hospitalizations, et cetera.
Okay, so now that we meet this new criteria, what businesses is the county looking at moving to open?
Right, so basically, this is a variance for allowing the rest of phase 2, or that is, I should say, stage 2 of the governor's plan to open. So what's included in stage 2 that we haven't asked for yet are the restaurants for outside dining, outdoors, the summer day camps. It's kind of expanding upon the child care that we had open before, drive-through religious or other ceremonial occasions, like, say, for example, pastor services, graduations that people can drive up, stay in their car, and nobody gets out of the car, the family groups are in the car, and high school seniors can receive their diplomas. That's an example.
So we'll see a drive-through graduation then for our high school seniors, most likely?
I think so. We're working with the superintendents of the school districts to implement that. We'll have very specific guidance for how this can happen, like 200 cars lined up at a time, no one, as I said, no one getting out of the car, and the high school senior and their family, their household members driving up, rolling down the window, wearing the facial coverings, and then receiving the diplomas. But of course, the cars can be decorated any way that people want, and that kind of ceremony can still happen.
And can you talk a little bit about what this process looks like with the state? Because I know a lot of people are seeing what the county is asking for and kind of expecting that we might have an order on that sometime later this week. Is that correct? Can we kind of assume that what the county is asking for we might get here?
Well, we're in negotiation. The things that are in stage 2 of the governor's plan will likely be approved. And that's pretty much most of the things that we're asking for.
Okay, but again, we'll have to wait to hear back from the state.
Yeah, and that will be posted on the state's website, and everybody will have access to see what it is was approved. It'll probably be up by the next couple of days.
So we should hopefully have that news by the end of the week.
Yes.
Sounds like. Okay, and so at the Board of Supervisors meeting yesterday, I'm sure you've heard a lot of comments about people being, both excited that businesses are starting to open, but also fearful that we might not be ready. And then we did hear during a press conference today on an alliance of healthcare workers called HPEACE, and they say that they don't feel it's safe for the county to move forward with accelerated reopening because they don't feel like hospitals are following countywide standards for PPE or that the standards are clear, and that different healthcare providers have different policies And some of the examples that they felt were particularly unsafe were that they were hearing from healthcare workers who were asked to use the same mask reuse the same mask for a week, or that N95 masks were not being provided through their workplace. Do you feel that healthcare workers will be adequately protected during the reopening?
Well, as you know, we have a lot of guidance out there for healthcare providers. We're very clear that when healthcare providers are working with patients that might have COVID, have any kind of respiratory symptoms, or actually have known COVID, that they need to protect themselves with the personal protective equipment. That would be the N95 respirators, the gowns, the gloves, the face shields. And that guidance is out there, and I think the hospitals are complying with that. Now, for other non-COVID related patient interactions, we have recommended that healthcare facility staff wear the isolation masks. That's the surgical masks or lower. We're calling them isolation masks. And we also suggested, or had an order for this, for the skilled nursing facilities. We've also are expecting congregate facilities, not patient care facilities, but jails and residential care homes and board and care homes to try to use the isolation masks, or at least use facial coverings. So I think we've sort of covered this all with our orders and guidance.
And can you talk about your process of working with healthcare providers, and specifically not just leaders of different hospitals, but doctors and nurses on these issues?
Yeah, so we have calls with our healthcare coalition twice a week, where we go over all of the updates, answer any questions from every sector, whether it's hospitals or clinics, skilled nursing facilities, the EMS programs. So everybody has a chance to answer the questions. We provide health alerts for all healthcare personnel every time that we issue something new. We've got our website, SoCo Emergency, where we post everything that's latest, as well as everything since the beginning of this pandemic on coronavirus.
All right, so we're going to move into some viewer questions here as well. So the first question also has to do with reopening. It's from a senior. We are now entering stage 2, but what does this mean for seniors? Are they still to be going out for only essential needs?
I think that would be advisable. I still think that protecting our most vulnerable populations, that's people over age 65 and any people of any age with any underlying medical conditions, that's still one of our main goals. So I would advise anybody who's at higher risk to still comply and remain at home.
And can you talk about the extent to which dental offices are allowed to open right now? And this is written in by a dental hygienist who wants to know because she's expected to work and masks are limited.
Yeah, so what we've done is basically expand the services provided by dentists and healthcare providers to more non-essential, non-urgent elective procedures. So before, where you couldn't go in to get a routine teeth cleaning, now dentists can be open for that. Same with the orthodontists, same with solo medical practitioners. The hospitals are starting their elective surgeries again. And this also applies to any other healthcare provider. That would be acupuncturists, physical therapists, chiropractors, et cetera.
What about art galleries, bookstores, music stores? When will they be open for browsing?
Yeah, so that is not a part of stage 2 at this point.
So we'll have to wait on that one?
We'll have to wait on that one.
Okay. So this one it's a specific employee question, but I'm going to bring it up because I think it's a lot of people as they're reopening are kind of grappling with questions like these. My employee has a headache and muscle pains without other symptoms. She tested negative. Should she be quarantined?
So at this time, those are fairly non-specific symptoms, and at this time, we want to continue screening individuals if they become more symptomatic, say develop fevers or have coughs or throat, things that are more consistent with COVID-19, then I think that individual needs to be retested. And I'll take this opportunity to say that we do have an app that IBM has partnered with us on that is for screening employees, and it will be used in all businesses. And we're asking it to be mandatorily used in open businesses for employees to self-screen themselves before they come to work, and or for employers to verify that employees have screened themselves or do that screening. So that's going to be put in place as we open.
All right. And what about our testing capacity? Can you give a quick update on where we are and where your goal is?
Yeah, so as of yesterday, OptumServe, which is our state-funded testing sites in Santa Rosa and Petaluma, doubled the number of persons that they can test. And I heard that they had tested close to 560 people. And they are still packed in terms of the appointments, so people can call in and make an appointment. We also have an additional 200 to 300 people we're testing through our Sinead lab through public health. So I think we're there now in terms of being able to test the 750 persons a day that was our goal.
There as of yesterday?
Yeah.
Okay, that's good news. What about the serology or antibody testing? When will that be available and how will that be put into place?
The machine has arrived, the tests have arrived. The laboratory is performing quality assurance for the test right now, and we're going to be rolling out a plan next week for where we're going to start, who we're going to test, and how we're going to do that.
All right, this next question is another kind of workplace issue. My employer is planning to reopen for half the staff by the end of the month, but testing is completely optional. So this person doesn't feel safe if testing is optional. How can workers feel safe if there's not a guarantee of regular testing?
So if you go to the Economic Development Board website, you'll find posted there industry-specific guidance for every type of business that may be opening. And you'll see that we have lots of mitigation measures in place. That would include the employee screening that I talked about, that includes verifying temperature check, and also includes the social or physical distancing protocols and the facial coverings, general hygiene measures. So I would say that even if employees are not being tested, that the workplaces are meant to be safe.
All right, so we have one more question, and we actually got a few of these. So some people cannot wear mask coverings for more than a few minutes, which I did not realize till we got these questions. How is this being addressed so that we can go out in public?
I think that's a difficult question. I think if you have an underlying medical condition that it makes it unsafe for you to wear a facial covering for prolonged periods, then that would supersede wearing a facial covering. I still advise the social or physical distancing of 6 feet from others, all the other general hygiene measures, and that person take more care to ensure that they're not exposed to others.
Well, thank you so much for joining us, Dr. Mace, this week, and we look forward to having you on next week as well.
Good, thank you so much.
All right. James Gore, Sonoma County Supervisor for District 4, spoke with News Director Steve Mincher yesterday. Gore was in the midst of a 2-day back-to-back session at the board, and they spoke about the county's plans to move forward with reopening.
Now, as we went on the air last Tuesday, we were learning just for the very first time about some disproportionate toll of the virus among our Latinx community. I want to know what you're hearing from members of that community about when and how opening up will affect this community particularly, and if there's some struggle between various members of our community about who's going to be hardest hit when the orders come down for us to open up.
Well, two ways to look at this. One is the issue of inequity and privilege in a time of COVID as a bigger concept. The second is this issue of opening and how it affects people. So on the first one, I've been very loud, and this morning put quite a few proposals down in front of my board that even though we're facing budget shortfalls, we have to double down on the equity side of the equation. We should be creating a position for our an equity officer at the county. We should centralize it. We need to resource it because it's not something that we can wait for, because this is actually attacking through inequity. The individuals who are on public transportation and carpooling are at higher risk. The individuals without health insurance and without sick or paid leave are the most prone for financial ruin in a time like this. The individuals who are oftentimes working in the service sector, which are the front lines, happen to be predominantly Latino in our community. And our businesses, our Latino businesses, are predominantly people who have taken over the service sector that they worked in. This is what I've learned from our Latino leaders as being a board liaison. And it is outrageous that we have not institutionalized this kind of equity work up until now. So I put a proposal before our board for us to discuss it in 2 weeks during budget. And I'm anticipating that there's going to be a lot of support from my board, because we are committed not just to do the equity work externally with outreach, partnership, collaboration, but internally, hiring practices. Does our workforce represent the community, and other things? So the second part of that, if I can pause and kind of switch streams, is this issue about should you open or should you not? And I'll go back to the empirical analysis by Dr. Mays and the attestation. It is not just a one-dimensional, do you open or do you not? But it was striking, because I've had some of the same people who have told me that their biggest worry is that Latino workers are going to be homeless, and this is from Latino advocacy organizations, also telling me that they're worried about Latinos going back to work and being on the front lines, and how we shouldn't open the economy. And in the middle of all that is that if people aren't earning a living, and if we don't have the true subsidy support needed to sustain an entire community over the course of a year, then we do have to follow the science of Dr. Mays, and we do have to live within a lower risk threshold, but a risk threshold of COVID.
Finally, James, was there something that you had hoped that we could talk about today that's on uppermost in your mind? I wanted to give you the opportunity. You have such two crazy busy days, Monday and Tuesday, and the board really getting together for this crucial business of working together on so many issues. But I wondered if there was something that had floated up to the top and that you really were hoping that you and I would talk about today.
I'll tell you, Steve, it's a weird, methodical, insidious time. I oftentimes think in my head, going back into my time of running around trying to report to my community on fires and recovery and then floods, and the intensity of those moments, and what I learned during those about bringing people together and about uniting around recovery and responding to this thing that was so right in front of you, this fire or this flood. And I think about how difficult this is for everybody, how the numbers we talk about in terms of unemployment or business loss are really people's lives and their dreams. I think about how for many people, you can't see this as a fire or as a flood. So you don't trust sometimes that what people are telling you is real. And that lack of trust and that abundance of uncertainty is in itself a disease within COVID. And so for me, I challenge everybody to do what I'm doing too, which is to share a little bit of love with your community, post something about your kid. Don't let the internet become a cesspool for negativity. Stay connected to positive. Organize things in your community. I mean, this community is so inspiring because it's the most active community I've ever lived in, and I was born here. And I really hope we can find the ingenuity to live in spite of this dark time.
All right, James Gore, Supervisor for District 4, thank you so much for joining me today.
Thank you so much.
Demographic data released last week shows Sonoma County's Latino residents are 4.5 times more likely to contract the coronavirus than white residents. NorCal's Adia White spoke with Alegria de la Cruz, Chief Deputy Sonoma County Counsel, and Sonoma Valley Community Health Outreach and Event Coordinator Mari Carmen Reyes about what is being done to address this disparity.
I think the first important thing that the county is doing to address this is to actually face it. Did anybody else really enjoy the Obama graduation 2020 event that happened this weekend? Megan Rapinoe shared a James Baldwin quote that I think is perfect for what it is that we're trying to do right now. And it's that not everything that is faced can be changed, but nothing can be changed until it is faced. And that's what the county is doing right now, is really looking at what the difference is in the impacts to our communities based on demographic information. So we know in California that Latinos make up 85% of the agricultural workforce, 59% of essential construction, 53% of restaurant workers, And all of those folks are essential, not only in kind of phase one and moving into phase two. And all of those numbers are really overrepresentative of, who we are in the population as a whole. So we're also looking at important data from a local survey that was released from First Five, Sonoma County, that showed small sample size, informal study, but it was really looking at differences between English-speaking families and Spanish-speaking families. And one of the biggest pieces of information there that jumped out at many of us was that 38% of Spanish-speaking families in this study had lost all of their income. And so we know that the economic and the health impacts that are being faced by Latinos, Latinx people in general, indigenous language speaking people, Spanish speaking communities is much more intense than their representation in the larger community. So we're really looking at that. We're facing it, we're stepping up, we're naming it, and we're doing that in a couple of different ways.
One of the ways that you're doing that is you've created a task force, which you're both on. Can you talk a little bit more about what kind of things this task force will look into and what has come out of it so far?
Sure. So when our emergency systems kicked into gear this time, we have the tragic privilege of being well practiced in disaster response. So we get to build on lessons that we learned in 2017 and 2018 floods and 2019 fires. And we knew that we needed demographic data to design our emergency response. When we analyzed our data, when we started collecting it, we acknowledged and shared that there are far more intense impacts on the Latinx communities, on the indigenous language speaking communities. So we're really moving from just the basic skills of needing to translate information into these languages. And now we have the honor to really tackle the challenge of culturally responsive outreach and program design in emergency and recovery mechanisms. So the first way that we're doing that is through the leadership of our board of supervisors. So each supervisor chose an issue area to focus in. And we're really lucky that Supervisor James Gore chose to create an equity core group of staff. So these are the staff who, kick into those emergency gears with our public service compañeros, and we're usually tasked with the additional work of developing messages, sharing information, gathering feedback with our community in the way that we do to identify, and this core group is now really looking at identifying a possible permanent home for this kind of work in our institution. So this is the work of essentially institutionalizing an equity response within the County of Sonoma. And then we're also doing this work at a department level. So immediately after analyzing the demographic data, Director of Health Barbie Robinson convened a Latinx task force, recognizing the importance of making key connections to ensure that the department has the benefit of expert input from key Latinx leaders in health and equity, as well as enhanced access to critical partnerships to allow local government to more effectively reach and serve all communities. We recognize that there are communities who are going to require us to use new skills, new tools, and new strategies because of the ways in which they and we have been historically institutionally underserving them. So that task force had its first meeting last week. And Mari Carmen we're happy that she's part of that task force. There's momentum, and that momentum is largely driven by frustration and sadness and the urgency that we all feel now, given that we have data that shows what we knew, what we were seeing, and what we were experiencing. So este trabajo nos urge. What I just said is that this work is urgent, and I used Spanish because it's one of those situations where the Spanish language really is a better way to describe the urgency. Like, nos urge este trabajo. It's pushing us forward to do things that we need to do in order to flatten this specific spike in this specific community in this curve.
And Mari Carmen, can you talk a little bit more about your work at Sonoma Valley Community Health and what kind of things that you're seeing with respect to this disparity?
One of the main things that we want to let people know is that the COVID testing is free. We want to let them know about alternative payments, like the sliding scale program that health centers have in comparison to, hospitals also have financial programs, but here at health centers, we have sliding scale programs and where we can help people that are either uninsured or don't qualify for insurance or are underinsured. So that's one of the things that we really want to get across to the community, and that it is possible to access healthcare, because that's one of the main concerns or things that has come out, or one of the topics that has come out is that health access for Latinos in this case in point. So we really want to make sure that, people can trust and make the call to see, how they can get services without having to, be fearful or not, face if they have the situation, if they have any symptoms.
So I want to share a little story. The Food Max on Sebastopol Road, right in the heart of the Roseland, an area in our community that we know is, a centralized place where many Latinos live. I had a friend who went there last night and saw that there was nobody at the front door of that store making sure that people wore masks as they walked in the door, and that a lot of people in that store were unmasked. And even though the employees were masked, okay, they're doing something right, they weren't being as protective of a community in the heart of a Latino neighborhood. I'm privileged. I get to walk to my local market. If you walk into my local market with no mask on, they will literally chase you out of the store. And so, this little anecdote really validates what I think many of us know, is that our institutions can treat us differently depending on where we live and the color of our skin. And so I tell the story because I think it's important for us to figure out how we have an enforcement conversation that really focuses on the root of the problem, not on the people who are getting sick because of the problem. And so, this conversation here, I think, really implicates the ways in which we work with our community partners to make sure that those institutions who have a responsibility to make sure that they're doing everything they can to comply with the excellent orders from our public health officer that are grounded in science, that they're doing that, and that they're doing that equitably across all communities, without a focus on the individuals who may not be wearing masks because they're isolated from messaging that's coming out from our public health, our public health officer, or whether or not folks don't have Facebook or broadband internet access. Those are all questions of equity that result in people not having access to the kind of information that those of us in the mainstream may have. So it's really about kind of not policing, but really looking at what are the root causes and not focusing on how we are going to further marginalize and scare people away from the resources that are really designed to help them, to keep them safe, to protect them. So, we are aware of the ways in which this enforcement conversation really needs to be considering these issues of equity and looking at the root causes of why people are getting sick, how they are getting sick. So to that end, the Department of Health is also really looking at and has using demographic data to look at, okay, where are communities of color, where are marginalized communities living who are now COVID positive? And so to that end, over the weekend, the county held 2 different testing sites in areas that are more prevalent where Latinos are living. So in Roseland, and 27 people tested in Petaluma, and 108 people tested in Roseland.
So I do also want to mention that we are working on setting up testing sites here in Sonoma Valley, that we will be doing a formal press release today and putting on our website as well, that we will start to do weekly, or actually daily testing, Mondays through Saturdays. Every day we will be starting this week on Wednesday, Thursday, Friday, and Saturday. Our main sites will be the hospital, Sonoma Valley Hospital, and Altamira Middle School on Saturdays. And that's subject to change. If we see that there's more need for Altamira School, we definitely can, get the feedback from the community and make any changes as needed. But we do want to invite, the community, and I really appreciate hearing Alegria to see how it went at Petaluma and at Roseland. And that's something that we also, want to support in the county, getting the testing numbers so that they can continue reopening through the different phases.
And how did the testing go over the weekend? Was there a lot of demand?
I think the data for me that was really interesting to see is in Roseland, where we had 108 people tested. Ultimately, there were 63 folks who made, prior appointments to come and get tested, and there were 47 walk-ins. And I feel like the walk-in number is what's really important here. That's folks who were, in the community, saw what was happening, had some curiosity and some need, and showed up, and we were able to handle that flow of folks coming in. So those being able to see and really look at that data in a way that allows us to analyze what's happening and how can we continue to use and understand, and learn from those experiences that we're popping up. These are new creative ways that we are trying to address and to go to where people are to make sure that they have what they most need. We know that folks are not psyched about going to their doctors right now. People are afraid to go into healthcare institutions. And so how can we bring these mobile testing operations in a way that really addresses, this is where people walk on Saturday mornings. This is where the taqueras are. This is where people are going to pick up their tamales now that things are opening up a little bit more. That's where we need to be, knowing what we know about this enhanced impact on Latino families right now, and the numbers of transmitted cases that are shockingly higher in that community than they are in the rest of our community.
In San Jose, the capital of Silicon Valley, there are still households without internet access. The city has been implementing an ambitious 10-year digital inclusion plan to close the gap. But access to the internet has become even more essential during the coronavirus pandemic, as many are working from home or teaching their kids at home. South Bay reporter Pamela Lawrence spoke with San Jose City Librarian Jill Bourne. She's part of a team addressing the digital divide in the city's emergency response plan.
We know internet access has become a basic need, and it's an on-ramp to education, to jobs, to healthcare. And in San Jose, I've learned that there are about 95,000 residents that don't have access to broadband, and many of those are from Latinx and African American families. But San Jose is working on and implementing parts of a plan already to fix that digital divide. Can you give me an overview of that plan?
Yes, well, in the past couple of years, the city really created a focus on digital inclusion as a major sort of factor of equity for our communities. And so worked with all of our telecommunications companies to develop agreements that would lead to the build out of broadband throughout the city. And also developed a plan that would allow through those agreements to create what's called the Digital Inclusion Fund. And the goal with the fund is that as a funding is sort of deposited in the fund from those agreements, it'll generate up to about $20 million. And those monies are then allocated to organizations that are dedicated to what's called digital adoptions. And so for a resident to really be sort of digitally adopted or have adopted technology fully, they have to have access to the technology. Certainly, they have to have access to the connectivity, to the broadband, and they also have to know how to use the resources.
Sure. Okay. So enter pandemic. Now the need becomes more urgent. So what's San Jose doing with that in mind? What changes have had to been made to the plan?
Yeah. So, gosh, about a month ago, it seems the city stood up. We call it an Emergency Operations Center team, a branch within the EOC that is dedicated to digital inclusion in the emergency response phase. And so there are a few key tracks that we're following to try to sort of escalate, but also accelerate the rate at which we are trying to achieve what our longer term vision was. In the next few weeks, we're actually going to be hosting 2 device drives, they're calling them, so that people can, who have resources, can donate a device that they're no longer using but is in good working order. And then we will work with our partner, the Tech Exchange, to ensure that those devices are operable and can work with the school districts, and then distribute those as well. We're also looking to, well, we've created a map for me, it was the first time to be able to see our team put together this map, because the goal, what it really starts to show you is that as we advance these projects, which are capital projects, they do take time. But for us to have a really concrete timeline that we are showing on a map, like how we're closing in the gaps that our city is experiencing, and then how we can prioritize any resources that we are able to bring in.
Are you able to talk about where those gaps are right now and how do you prioritize the need?
I don't think we have the total picture, but we know from the studies that have been done in the past and the current data that there are, they call them digital deserts, definitely in our east side area. And so as we're filling in with different Wi-Fi projects that are already underway in partnership with the Eastside Union High School District, that creates basically a Wi-Fi service area around each of the high school areas, service areas. So as we're piecing those together, there are some pockets and kind of, I would say, like central east side that we're looking for some other solutions.
Do you know what the communication is like for residents who might need devices and access? How are they finding out about the resources?
Yeah, that's a great question, because I think to date it's been through, there was this big focus on the schools, and there still is. And so I think that it's through the different districts and their networks and how they reach out to parents. And then recently, as we've started to initiate other efforts like the device drives, we're starting to utilize the city of San Jose's communication systems and those of partners to get the word out to the right communities. But we have sort of aligned an internal team, because immediately we knew that the hardest to reach households are the ones that need it the most.
We reached Representative Jared Huffman yesterday after he returned home to Northern California from a momentous day in Washington, D.C. The House of Representatives passed a legislative package that many are calling an opening bid, as Democrats and Republicans disagree over what needs are still not being met during this crisis.
Now, you were very busy in Washington on Friday, and I did want you to give us a sense of the drama of that day as the House of Representatives. Now, you were very busy in Washington on Friday, and I did want you to give us a sense of the drama of that day as the House of Representatives passes a $3 trillion legislative package. Can you tell me what you feel are the highlights of that bill?
Sure, I'm happy to speak to the highlights of the bill, but to your point about the drama of the moment, I mean, you would expect a lot of drama associated with a $3 trillion piece of legislation in a critical moment for our country like this. But like everything else during this pandemic, it was a little surreal. Members are not even wanting to go anywhere near each other for obvious reasons. Everybody's wearing masks for the most part, although we have a significant number of Republican colleagues who have decided to ignore public health guidance. They don't wear masks. They were kind of mugging it up and walking around without distancing. So that stood out as well. And then members were brought down to the floor in groups where we were just not around each other in the normal way. And we had to maintain distancing. You literally have to walk in a certain pattern in and out of the floor to cast your vote and then to get out of there. So it's unlike any other moment in our country's history, the operations of the House of Representatives right now. But I think the impact of what we did is significant. We put forward a bill that reflects the actual scale of what we believe this crisis to be. And we think that includes more than just kind of a one-time shot to a little bit of direct assistance and a little more unemployment for, a few weeks, and this paycheck protection loan thing for 10 weeks for some companies where it works. We think this is a much longer lasting and deeper crisis than what any of that has reflected. And I'm pleased that we actually put forward at least, an opening bid from one house of Congress that matches the scale of the crisis, that does far more than any of those things, that actually pushes hundreds of billions of dollars down to state and local governments. That's the next point of this crisis that has to be addressed, because when you think about the essential services that all of our local governments support, not just maintaining our roads and things like that, but public safety, sanitation, public health, their revenue streams have collapsed and they are struggling to keep the lights on all over this country. And if Congress doesn't step in and help them right now, we are going to make this crisis much, much worse.
Now, you mentioned that this was sort of an opening bid and that your Republican colleagues aren't necessarily on board with the scope of your $3 trillion package. Where do you find are going to be the points where you can come together and really get something done for the American people over these next couple of weeks?
I think that's going to depend on their willingness to open their eyes and see the crisis in its full extent. When you have Mitch McConnell saying, let's just take a pause and wait for a while, when you have the Trump administration engaging in this happy talk about a V-shaped recovery and, you know, giving all these mixed messages, on the one hand, acknowledging some of the public health concerns, on the other hand, applauding as states recklessly move forward with relaxing and reopening without following the rules. You know, we're just going to have to force them into a better conversation about how to address this crisis, which starts with acknowledging what's actually happening out there. You know, the other part of our bill that I'm pleased to see that we're going to need to keep pushing on is that we looked ahead to November. We recognize that we've got a national election that's critically important, that is going to be hard to conduct if there's a major outbreak and if we're not prepared to give voters tools like a mail-in ballot all over this country so that we can safely proceed. We don't want a repeat of what happened in Wisconsin a few weeks ago, where they weren't prepared and they had this chaos with the governor saying don't have the election, the Supreme Court saying have the election even though it's not safe, and then voters are presented with this terrible choice of making themselves ill or not voting. So we include that in the bill that we passed out a few days ago, and we also include something that is essential for that and other aspects of our economy to keep working, which is support for the U.S. Postal Service. They're in real trouble, and our president has deeply politicized the financial situation at the Postal Service and kind of carried into that issue some of his own personal vendettas against Jeff Bezos and Amazon in the most childish and political way imaginable. So we put a good postal funding provision into that bill, and that's something that we're going to continue to fight for.
There seemed to be a fight brewing here in Sonoma County, as elsewhere in the country, about opening. And some in our Latinx community say that reopening our economy will be on their backs. From farm workers to domestic workers to fast food workers to healthcare workers who are mostly Latinx and often female and who can't work from home. So I'd like to really get your point of view about what we need to be thinking about now that we have some of the demographic data to suggest that our Latinx community in Sonoma County is being disproportionately affected.
Well, they're right. Let me just associate myself with those concerns. And we are finally beginning to get some resolution on the data that shows just how disproportionately they have been hurt. Now, part of that is because of socioeconomic factors, the fact that we have, you know, greater density in a lot of the living arrangements. We have larger family units in many cases. We have some pre-existing health conditions and comorbidities, as they say, which you know, may not address the vulnerability to exposure, but certainly addresses the severity of the impacts once someone is exposed. And so we've seen both more exposures and more healthcare complications within these minority communities than in other more affluent communities. And it's something we have to tackle. I'm pleased to see that we did that in the HEROES Act that we passed. We included resources so that we can surge testing and tracking and tracing into these communities. And by the way, you know, everybody agrees that there's three legs to the stool for tackling this pandemic. You got to do testing, you got to do tracking and tracing, and you've got to do meaningful isolation when you identify people with the virus. But that means we got to hire hundreds of thousands of people around this country to do that tracking and tracing. And we've got to make sure that they are culturally proficient and sensitive to go into these communities and to actually do an adequate job, to establish the trust that they're going to need for cooperation in these communities. And then you can't just assume that it's possible for someone who's working 3 jobs and crammed into an apartment with either a large family unit or with other roommates to isolate. They've got nowhere to go. So we're going to have to figure out a way to finance that and to either pay them or to enter into relationships with hotels or other places to have serious, meaningful isolation, or else the spread will continue. So lots of reasons why we've got to put more of a focus into these communities.
Well, we got a lot of questions this week about when the state of California would begin to open their applications for aid for undocumented immigrants. So I want to give a short update about how you can apply for that aid. So the applications for Disaster Relief for Assistance for Immigrants project opened on Monday. Now, in Sonoma County, California Human Development will be administrating that aid, so you have to apply through California Human Development. Now, you apply by calling this number, so get your pens out and ready. The number to apply is 707-228-1338. Again, that's 707-228-1338, and they will help you, walk you through how to do the application, as well as make sure you qualify, but you have to call that number to do a screening, and they'll walk you through. Now, we did try that number several times today, and it is busy at the moment, but keep trying. Hopefully you can get through. And if you have any more questions about aid in the county, you can go to norcalpublicmedia.org/coronavirus and let us know, and we can send you our document on how you can apply for relief. So back to you, Darren.
We hope that you'll join us next Tuesday night for our next live interactive town hall program. That's Tuesday night at 7 o'clock. Now, remember to share your questions for our next program by using the contact form at norcalpublicmedia.org/coronavirus. The contact form is displayed on every page of the website dealing with the coronavirus outbreak in the Bay Area. So remember, stay tuned in to NorCal Public Media for the latest news. I'm Darren Lashelle with Adia White. Good night.
You're watching Northern California Public Media, made possible by viewers like you.